child pose first. Stay in child pose. Open your palm, open your shoulders, open your knees, elbows relax, forehead on the ground. Then lift your body, get into the four stand. So open your feet, okay, and check your the wrist, knee, toe has to be straight line both side. Once you're ready, then inhale, roll your back, open up and look at the ceiling. Exhale, roll it down, chin and chest together. Inhale, push down, open the hip, open your chest, open your neck. So extend the neck when you exhale, roll it from down and down and down and down, chin and chest. That is speed number one. Inhale up, exhale down. Inhale, this is a good asana, good movement for most of your common back and hip and shoulder and neck related pains and discomfort. Speed number two, up, inhale, exhale down, up, inhale, exhale down, up, inhale, exhale down. Last time, more fast, up, down, up, down, up, down, up, down, up, down. Go back to the child pose. This time you can do the support child pose. The cat and cow is a very good asana for even for your liver to get good functions. People have fatty liver, any liver related issues, that asana will helpful as per the new research. Let's go to the tiger stretch. Get into the position. Kick your right leg like this, hip level. Then your opposite hand is your left. There's a Tristi. Tristi is your point your thumbnail. Then inhale, hold your breath. Then give a stretch. Kick your hand forward and kick your leg back. Hold on. Breathe in. Then exhale. Done. Only one breath. So you get into the position. Now normal breathing. Then your right hand up, left leg. Then I'm inhale. Long breath. I want to hold that breath as long as I hold the pose. Hold the breath, hold the pose, stretch your hands, stretch your leg, exhale, quick. Then repeat again, right leg, left hand. Can you do with your closed eyes? If you're safe, just close eyes and balance, relax. Other side. Balancing is very important part to activate your more balancing hormones, chemicals in the body. Ready? One more time, and the last time. I want you to fully close your eyes and focus and balance. Change nice. Repeat. Don't open your eyes until you complete both sides. Good. Go back again. Full child pose. Child pose is a wonderful asana. Just going back, open knees, open palm and relax. You can do on the mat. You can do on the bed. Early morning when you get up, if you feel your bladders are free, you can do at night. Anytime when your bladder is free, just sit. In your office, you are busy sitting 3-4 hours, you don't know how long you are sitting. Get down and do it whenever you have a space on child pose. It's a very good asana to open your lower areas. Thread and needle, so you're going to get into the position Usi Nulasana. So keep your left hand firm. Push your right hand to the left side, then swing like this, like a triangle pose. Keep it firm, extend, keep the fingers open. Inhale and exhale, quick, fast. You roll the hand inside, turn the head, left hand coming over your left ears, and right hand is cross. And turn your shoulders as much as turn your hip. And time to breathe in and out. Thread and needle, Usi Nulasana, very good asana for shoulders, neck, back, down to release the tensions. Done. Release and relax. So now other side. So right hand firm, swing the left and open like this. Shoulders completely open. Look up. Turn the head and look up. 1, 2, 3. Press it. And then head turn. Hand over the ear, breathe in and out. Good, done. Release. Come back to the Shashangasana. Open your knees firm and interlock your fingers back. If you're comfortable, try to do as much as you can. If not, minimum 10. Inhale, bend back. Exhale. You're going to open it up, your shoulders. Open your knees and let your forehead comes and touch the ground. If you cannot touch the ground, put a pillow and touch the pillow. The rest, then you come up. Keep the hand, touch the ground, rest the hand, little push, bend back to the neck. Then you roll your hand and touch your forehead and try to push your buttocks to the heel. It will go up little. Not everyone can touch your feet and heel and buttocks same time. Some people it will go up. When you pay attention and try to push down or do not allow not to go too much up. 3 times done. You must 7 more time. Continue 7 more time. This is such an important practice to enhance your blood circulation, open your respiration muscles. Good asana to improve your breathing. Ten times, okay? If you cannot do continuously 10 times, take a break. 3 times, 4 times, take a break, then continue the rest. If you need, you can support your knees, support your ankle. Always make sure you are comfortable before do any practice, especially in yogic practice. Done and release your hands. This time hands is going side, forehead on the ground. Just relax. Next one is difficult but try. It's called pigeon pose. So you kick your left leg, lift your right, rotate your right, opposite side. Since you already did Pavan Muktasana, it's not that much difficult to warm up. So swing it up. You can swing like this. If you are good, you can even go for a mountain to forward. Mountain to forward. Ready? Now bring your right knee all the way towards your right wrist. Your right heel is touching your left hip region, the prominent, the bone on the front. Then your forearm down and elbow down and thumb pointing up. Stay like this. Sometimes you will feel little pains and aches in your knees, hips, depends on tightness muscles. Good, there you go. You can warm up by roll your hip, allow your buttocks to touch the ground. If this is difficult, then you can go for little upper higher one and just push this lateral movement muscles towards the ground. Then come up slowly, straighten up. And whenever you're ready, your hand can go up or you can stay, or even you can keep your hip, or you can touch the ground as much as you straight and little bend back. Know your limit, know your condition, move your body accordingly. Do not hurt your body. That is called imsa in yoga. We don't do imsa, we only practice ahimsa, no hurting. Come back and forehead on the ground straight. The next part, come up again. You can swing very slowly. Keep your knees relaxed and swing. If you feel severe pain or very discomfort, you don't do. And hold it and stretch backward first. 1, 2, 3, forward where your heel comes and touch your butt. Stretch back. Here when you do it, the front thigh, you have little pain. That is stretching pain. Done. You're going to repeat the same thing to the other side. Balance again. So lift your left, swing it front and back, rotate opposite side, or higher swing up and forward, then bring your left knee on towards your left wrist and stay for a while like this. Then take your time, forearm down, then the rest. There are many ways to technically to correct this pose. It's not easy to looking at TV or looking from far away to check your pose. You need to learn directly to get the right pose. Come back up. So warm up. Roll down, up, down, up. This is difficult, then you go for a modification. Down, stay down and roll. It's up to you. When you come up, sometime your back will hurt. Stay here. Make sure your front knee is firm, the hip is firm. Hands up and bend back. Swing it same way forward. This is not just a one day, one time pose, one week, once a week. It's not going to make any difference. Daily practice. If you feel more and stiff, more and difficult, more and more practice you have to do it to get better and better. This is a wonderful pose, working with the many muscles and giving you such a powerful to the body to be stable when you stand, when you walk, when you sit, when you jump. All this is important. If you do this pose, you will feel very comfortable with all the major movements with your body. Stretch and bring it down. Stretch, bring it down. Good. It's called frog pose, Pabalai. So you open the knees further and try to put the chest, put the hand in and hold in the thigh and try to bring the hip more close to the body. Or you can bring your elbow, knees towards your hip, more up. Your feet is completely flat. You're not tucking your toes. Feet is sleeping position. Breathe in and out. Good. Straight up your legs. Turn to the one side. It's called Ananda Sayanam. Happy sleeping position. Happy sleep pose or sleeping pose by Lord Mahavishnu. Bend your one leg on the knee. Then you keep your left leg up and straight. First, we're going to hold and stretch. Then we're going to swing. So you just hold the big toe. If you cannot hold the big toe, hold your foot. Hold anywhere, even lower. Like this, you can do. This is a right way to hold the big toes with only two fingers. The thumb crossing. Then you can leave your hand down, relax your leg. If you're good in balance, then you have to straight your other leg and see you're capable to balance. You will fall one side or forward initially, but eventually you will get the balance. If you try to straight your other leg, then you will know what I'm meaning. Then come back up like this, head position. Now you bend your right leg a little down, a little forward. Then you're going to swing it up and down. So going up, it's okay your speed, but when you come down, you have to slow down. Slow down. If you want more mechanical movement in your body, you can turn your foot when you come up, out like toes towards your head. When you bring it land, then you can keep the foot flat. Up and down. You have to do 50 times. When you have a time, you can do 50 times. If not, minimum 5 to 10 is good. You're going to repeat the same thing to the other side. With your last one more movement is there. So finish the last one, then we'll go. Last one is you grab the ankles like Nadaraja. Then you push forward. Then you lift it back. For this, you put the hand down and hold the mat edge or anything. Then you stretch back as much as you can. Good. Release and relax. Let's do other side. You can, as I said, you can move 50 times. Slowly, 50 times. It's not 50 at the one time. You take a 20, then take a break, another 20, 10. Any numbers combination, you can finish 50. So first you're going to bend and hold the big toe and stretch it up and stay. This is a nice pose for people who have pains on the hip and knees and back, sciatic related, IT band related, many other conditions. It's a help. It's called movement. When you do movement, you will feel even your pain is moving out. Ready, go. Swinging up and down. You can keep the hand as it is. If the leg is not coming up maximum level you want, then use your hand and pull it up. Okay. Most of the time you will bend the knee without your intention. So take some attention and correct that knee straight. 5 times inhale up, exhale down. Once you finish your 5, you bend the knee, grab the ankle, first push forward to the chest like Pavan Muktasana, then you push back to the dancing Nadaraja Asanam and hold it firm. Get done. You release. Come back to the center and body facing down. Adi Mudra. Knuckles underneath the ground. Forehead on the ground. Raise your one leg up. Put your other leg like a stand. The purpose is not holding the pose. Purpose is breathing. While you maintain the pose, you have to breathe in and out. Can you go higher and higher? That's up to you. Bring it down slowly, always. To the front, to the left. I don't understand. I'm good without stand. It's, you can just do it without stand. Stand will give you more relax. You can pay attention to the breathing. So done. Now Navasanam, now Kasanam, then inversion pose, then Surya Namaskaram. So simple. Let's go. Navasanam. Navasanam daily practice. I seen a lot of people, students got a lot of changes, especially online and in person. Since because you're practicing, we are doing in every class that makes some changes in your body. Practice daily. If you're not getting one pose, then you practice. ஒருக்கா வராட்டி எவர்னாலும் செய்யுங்க. அது வராதுன்னு நினைச்சு விடாதே. அதுதான் தேவை உங்களுக்கு. If you are good in one pose, then you don't need to practice too much. Get done.